Hello and welcome to another Trib Talk Town Hall. I'm Jennifer Napier-Pearce, Executive Editor of the Salt Lake Tribune. So schools are set to reopen in a matter of weeks, but instead of preparing for the usual back-to-school purchases, parents, teachers, and districts are grappling with masks, crowded classrooms, and safety. And joining me tonight to talk about plans to return to the classroom is Sydnee Dickson. She is State Superintendent of Public Instruction. Dr. Dickson, thank you so much for joining us tonight.
My pleasure. Thanks for having me.
Also with us, Heidi Matthews. She is president of the Utah Education Association, which represents 18,000 Utah teachers. And Heidi, welcome to you.
Thank you so much for having me.
Joining us from the Pacific Northwest even. Thank you, Heidi. Laney Benedict is president of the Utah PTA, the Parent Teacher Association, with its 85,000 Utah members. And Laney, welcome.
Thanks for having me, Jennifer.
Of course. And finally, rounding out our panel, Dr. Kashif Memon is an infectious disease specialist at Jordan Valley Medical Center and part of the Steward Healthcare Group. And Dr. Memon, thank you so much for your time tonight.
Thank you for having me.
And we're taking your questions as well. Are you sending your kids back to school? Do you feel safe? What do you think about the statewide mask mandate? All questions are open, so please send those to the hashtag TribTalk. We're going to dive into the details throughout the hour, but just generally, I'd love to just get 30 seconds of how you are feeling today about returning to the classroom next month, and what are the facts that you're looking at? What is informing your decision? And let's start with you, Heidi.
Thank you, Jennifer. Just in general, the main thing I am hearing from teachers across the state is the concern for health and well-being of our students and our employees in schools. And we didn't really anticipate being in this growing COVID virus spread as much when we were talking about returning to schools back, a few months ago, and really need to make sure that above all else that we have health and safety at the forefront, so that what we do now in the fall makes it possible for our schools to remain open in the school year.
Okay, Dr. Dickson.
We've been reflecting a lot on our remote learning of the spring and how to improve that experience. So I'm really proud of our teachers, our parents, and our students who really leaned in an impossible situation and tried to keep learning going and feed our students and all the things that went on in the spring. So now as we come back to the fall, we're trying to reimagine what school looks like. And we didn't, as Heidi said, we didn't expect to be in this space again. But now that we're there, we're trying to help schools really mitigate the risk of the virus by thinking through characteristics like proximity and movement and respiratory output and congestion and group size and all of those things that we know from our health specialists, our health community, our great epidemiologists, et cetera, to help us try to mitigate the risk. And while we can't eliminate risk, all of the risk, we're certainly trying to do what's best for the adults in our system and our students. And that's why we're asking our systems to be nimble, be ready to go with remote, look at blended possibilities. If you're doing face-to-face, then make sure that there are ways for students and staff who are compromised to be extra safe. Think about the classes that you're teaching and how all of those characteristics of the virus come into play. So we're asking our schools to engage in a very heavy load in trying to get students back to school this fall and do so in a safe manner.
Dr. Memon, can it be safe?
Well, considering the situation we are in right now, I agree that we did not expect this. We thought that in summer and fall, things will be much improved, much better. This epidemic might be dying down. Some people are calling it the second wave. Some are just calling it continuation of the first wave. It kind of more looks like a second wave of our first wave in Utah. The peak was in April, and now we're seeing a second peak, which is much larger. And the last few days, the numbers are a little better, but I still think we have yet to see how things are moving in Utah to feel very comfortable for our kids to go back to school in fall.
Laney, what are you hearing from your constituency? How are you feeling today about going back to school?
You know, I had no expectations because you can't plan for stuff you don't know. And so we have really been waiting for the district's plans to roll out, and they're all rolling out at different times. And that's what we've been telling our parents and our members and volunteers is pay attention to what your school districts are rolling out and what their plans are, because it will vary across the state. We are all in the mixture. You know, some want to go to school, some don't, some want to wear masks, some don't. It's all over the spectrum for us as well.
So you haven't taken a formal position just yet?
We have not.
Okay. Sydney, the governor's plan to reopen schools gives districts a lot of leeway. They have until August 1st to come up with their plan. And then what is the process? Does the health department review that? Does the superintendent's office review it? Like, you know, what factors are you going to be looking at to say, yeah, this plan works, this one doesn't?
That's a great question. So the State Board of Education created a set of requirements and recommendations, and then we put out a template for the plans. Now, a district or a charter can certainly create their own template, but really just making sure that they're hitting all those points in the requirements. Their boards need to sign off on those in a public board meeting and have those posted so that they're very transparent and public. When those come to our board has chosen not to take the role of approving the plans because we see that as a local issue. We want our local charter boards and districts to really engage their communities and own the plan and do what works in their context, because we know that context matters. So we will review the plans, and if we see any holes or areas of concern, we would provide technical assistance and probably put those back to the district or charter and just ask them to address those points of concern. We've also had recommendations that we involve health professionals, that we, right now on some of our advisory groups, we have epidemiologists, we have local health directors, we have infectious disease pediatricians. So we've had health professionals weighing in all along the way. But we also think that it would be wise if districts and charters have not had their health departments or health professionals weigh in, that they also get that perspective before they even turn them into the board. And we'll probably run them through another layer just for that technical assistance.
Heidi, you said that teachers are really concerned. Is the teacher voice part of this process of developing the plans? How are you feeling about input at this point?
Well, and we have, yes, our teachers are very concerned and so appreciate being included with Superintendent Dickson and the number of councils and opportunities to voice our concerns. But we feel that the district plans that are coming through just are not going far enough. And we feel so much uncertainty from our teachers in these districts about what is how their districts are looking out for their health and well-being and their employment, specifically looking to really pin down what's happening. Let's use data. And rely on our scientists and less so on our politicians about reopening schools. And when the data says it's safe to do something, that's when it's safe to do something. And when we have the protective gear that our teachers need, when we have the educator voice, who we know how our schools work, and we want to make sure that our educators are there at every step of the way, and that we have to lead with equity, because this pandemic has not impacted people equally. It's been so much more difficult on our communities of color, on our rural areas, and especially on our people in poverty. And we have to make sure that any opening takes into account our most vulnerable people, and make sure that we are able to then maintain school in this way, because of course we all want schools to be open. It's important for our students, but we need a teacher with expertise in a well-resourced classroom, and we need the resources to be able to do that safely and effectively.
Sydnee, Dickson, is money on the table? I mean, for extra technology, if a student needs it. You know, our Utah's classrooms are famously overcrowded. Like, I don't know even logistically how you do that kind of social distancing that the medical community has recommended.
Yeah, correct. So we have received CARES Act money from the federal government. In Utah, we received about $67 million coming straight to K-12 schools. Another portion came to the governor's office. Higher education received some money. The legislature received some money. I appreciate that the governor's office, while his money, the money that came to him rather, could have gone to higher ed as well, he chose to put it towards K-12 and really address some of those issues that Heidi addressed with equity, focusing on students who need broadband and students who need additional time and tutoring and support. So we've been using all of that CARES Act funding to try and mitigate summer learning loss, as well as shore up some of the technology needs and protective gear, as Heidi mentioned. So a lot of those things we're waiting for it to come in. I spent 3 hours this morning sorting masks for our schools that Cotopaxi and Boeing and others helped us acquire. So trying to do all of that, but there's not enough money. There are some great ideas out there, and we've had parents and teachers and community members and professionals weigh in on all sorts of ideas, but you can't switch out HVAC without money. You can't spread students all over the community and find spaces to teach them to social distance if you don't have additional teachers. You can't have remote learning for all high school students and then spread elementary students out if you don't have broadband. That's an issue of equity. To me, broadband has become an essential utility, like electricity and water for families. So we're working in those spaces trying to make a difference, but until we address some of those issues of equity, and that does take funding and community support, we can't execute some of these great ideas that people are coming up with. And people have all sorts of opinions about this. We get emails and calls every day, all day long, about a variety of perspectives. And so to Heidi's point, you know, our teachers are really focused on trying to do what's safe, as are we, as are our parents, but there are a variety of opinions. So if we're really basing it on those mitigating circumstances and characteristics, that would take a lot of money and a lot of resources to ensure that all of those were in place, short of going to remote learning, which then impacts equity for students with disabilities, students learning English, students living in poverty, et cetera.
One of the things in your laundry list there were masks, and that has become a real flashpoint. The governor, of course, issued a mandate requiring masks in all Utah schools. Today, hundreds of people packed the Utah County Commission meeting, asking commissioners to ask for an exemption from this requirement. Laney, Benedict, I'm curious what you're hearing from your fellow parents about masks and the mandate.
You know, it's all over the place, back and forth, of people who prefer to wear the mask, who look at it more as, you know, it's a right to not wear it, don't infringe on my rights. But I do have to say, the PTA leaders in the local schools, they want to be helpful. They want to be positive. And I know several of the principals throughout the state have already reached out to the PTA leaders and asked them, do we have any other parents that know how to sew? Can you help sew masks? Can you donate the material to do the masks? And several of them are doing those things. Several of them are wanting to purchase masks for the schools as a backup to those masks that the government has provided for them. Because we all know kids lose things, right? And the first day, you know, you're going to have a ton of children that have already lost their mask and don't have it. So I do appreciate our leaders at the local level, at the schools, really thinking outside the box and really coordinating with the principals and how that's going to look like coming this next school year.
Well, especially the younger students. How do you even keep them on? Like, little kids are really hard to control.
I have seen a couple of articles that talked about children can do it too. And I think as parents, if you're choosing to send your child to school and we need to wear the mask to protect everyone, I think being a good example as a parent and saying, this is a positive thing, this is a great thing, we get to go back to school, but in order to do that, let's wear the mask because that helps protect your fellow friends and your teachers. And so I believe I did a presence training this morning, and most of them were pretty positive and want to be there to help the schools and volunteer in the schools as much as they're allowed to. And they're planning on wearing the mask.
Dr. Memon, do masks work in preventing the spread? And what do you think about a compassionate exemption? Should local health departments go that way when it comes to schools?
Well, I mean, I would say the bottom line first, masks do work. I know in the beginning we had the controversy, we didn't have enough masks, so CDC and all the health experts were saying masks don't work, only sick people use it and healthcare providers use it, or first responders. Then we, eventually the new data came, and this thing is so new, we are still learning a lot of things about this epidemic. So now we do know masks do work, and they do prevent infection and the transmission. So, I mean, in children, obviously, the other colleagues, what they're saying here on the forum, I agree with that. It'll be tough implementing, especially on younger kids. But I think it also comes down to the parents who are sending their kids to school, teaching their kids and educating them. But bottom line is, I think masks do work, and I think we need to do that. And all the Utah hospital associations, they have requested the governor, I think 2-3 weeks ago, to mandate universal masks. And I think if we do that right now statewide, I think we can lower our numbers enough that the school opening, might be a good possibility in fall, and we feel better about it.
The questions are starting to pile up, so I want to get to some of those. If you have a question for our distinguished panel, please send it to the hashtag Trib Talk. This from Sara on Facebook. I want to know what the plan is when a student or a teacher tests positive. Who will quarantine? Who will pay for the teacher's leave? I'll throw it to the group. I mean, Sydnee, let's start with you.
There are a couple of things. One, that I want to go back and address masks a little bit, because it was an order given in a press conference by the governor, but then the health department, in connection with the governor, issues an executive order, and there will be things laid out in that executive order of exemptions in certain cases. So that's more to come. At the same time, our local health departments, working with our state health department, are issuing a set of, amongst the groups, they are issuing a statewide set of the decision-making matrix for the very things that you're talking about. So if you have a student that tests positive, what do you do? How long do they need to stay out? If you have somebody who comes and they're symptomatic, what do you do? So we've already talked to our systems about things like having a place to isolate a student who might come to the office. That's why we're giving every school disposable mask, that you would immediately make sure the student has a disposable mask on, that there's protective gear for the front office, the nurse, whomever is in the school, to interact with that student. So all those kinds of protocols for the adults in the system, the students in the system, those are coming this week. And the HR pieces I will let Heidi speak to, because I know her association has been working on those pieces.
All right, Heidi, it's all yours.
Well, thank you. And I think that this kind of question is really what we are getting. Like, what happens when this happens? Who's going to pay for this? How are we going to be kept safe? And the bottom line is, what we do right now to open schools can preempt those decisions as much as possible. We have to be thinking about a long-term game of how to keep people safe, not just figuring out the details of when someone gets sick and how we're going to do that. Of course, we have to look at that as well. But there are not multiple opinions on wearing masks. There's science and there's politics. The masks work. I've had one pedicure since the quarantine. I had to have my temperature taken, and everyone wore masks. And I go into a restaurant, I get my allergy shots, and I have to get my temperature taken, and everyone wears masks. Why would we think about doing anything different in our schools? Why would we subject our kids and our educators in the classrooms to anything other than the most safe environment that we could possibly do? And honestly, and again, I'm appreciative of the work that's been done, but there are a lot of requirements coming from the state that come with a comma when feasible. And what that is very concerning to me, as it is to many of our educators across the state, because with our large class sizes and with our chronic underfunding of our schools, when feasible does not pressure additional resources. So it's a very good question from the person who asked it about, who's going to pay for that sick leave and who's going to, cover the classes. These are all really good questions, but what we at the Utah Education Association want to do is make sure that we do whatever we can to preempt those.
Sydnee, back to something that you said, that the governor will have some more specific guidance on all of this. And I'm curious, in your mind, what is non-negotiable? Like, if, we have to have this if we're going to reopen safely.
I definitely support the wearing of masks, and I concur with everything that Heidi said about that. It would be my hope, just like Dr. Memon, that if we were to do what we know needs to be done, then we would be having a different conversation. However, having said that, going back to those mitigating circumstances, so you can't have kids moving through halls without masks on. You can't have students entering and exiting where you've got density without masks on. So I would assume that we will see things like for students eating, obviously you can't eat through a mask, or if you're outside, and as well as distancing. So recess is a good example, where you might stagger recesses. Instead of having a couple of hundred kids on the playground at once, you would have much fewer, and teach them how to distance and what they need to do so they can have a mask break. You might have a student with autism with sensory issues who cannot wear a mask, or a student with who might be medically fragile, a student with a disability that would be exacerbated by the wearing of a mask, somebody who has severe asthma. So really looking at some of those medical conditions, I think that's where we would see some of the exemptions perhaps. But really thinking about, if you're in a classroom, to Heidi's point, and you've got multiple students in the classroom, and they, even if they're distance, we know that with respiratory output for more than 15 minutes, those droplets are kind of there in the air, even though they're mitigated by a mask. So just really teaching the characteristics, and I think our students, our families, our teachers, everybody knowing how the virus behaves, then you make those decisions in your school about when a mask can be taken off and when it needs to be worn. Mm-hmm. So, kind of that common sense approach that kids need mask breaks, teachers need mask breaks, but you do that in a safe way, for sure, that students are either outside or far apart enough that it's okay.
This is an email from Kristen. How will students be monitored for symptoms? Before we get to some of the proposals, Dr. Memon, what's your recommendation? How often should temperatures be checked? Is it every day? I mean, what do you think is the best practice as we start to think about, hundreds and thousands of kids going back to school?
Yeah, it's going to be a problem. So I think it will start with the parents. Obviously, parents need to be educated that they need to monitor their kids' symptoms. They need to be aware if their family member is infected or positive. And obviously, if that's the case and the child has been exposed, then the child should not come to school for 14 days. And if the child has any symptoms, the parents should not send the child to school. So I think it starts with parenting. And then at school level, I think at least once a day, if it is practical, at least minimum once a day, I think temperature checking is pretty reasonable, I would say. And then obviously then it's the monitoring from the teachers, the observation. If a kid is looking sick, obviously that kid needs to be taken out of the class. And authorities need to be informed. I think the health department will be a big factor. They need to be informed of any sick child, especially if the child has turned positive for COVID. What course of action needs to be taken, moving forward.
Laney, you said that the PTA has been really trying to demonstrate, what gaps can we fill? How can we be helpful? Are thermometers on that list?
They could be. I think we are talking, with the locals, and if that's a need in their schools, that could be something that the PTAs could budget for at the local level. And as long as the board votes for it at that local level, it can be a budgeted item for those. I know masks were considered. Other things may be considered that may not be potentially what we normally do, but we've told them this is different. We need to be flexible. We need to be a help and not a hindrance. And we still have to obey the policies in each district. So the communication is really key between those principals and the local presidents to be aware. We've encouraged them to be aware of their district policies, attend their school board meetings so they can understand that, because they're the parents in the schools that are in the know. And they're the ones that everyone's going to come to and say, what does this mean? What does that mean? And so that encouragement of trying to be educated yourself and knowledgeable of what's going on. And we definitely could budget for those items that the schools need.
Sydney, what are you recommending to districts as they develop their plan in terms of just monitoring kids' health, teacher health? Are there some guidelines that you've put out to say people should be have their temperature checked, or if they're, symptoms, or, is there some sort of checklist to let people through the door?
Yeah, again, the health departments are coming up with together a statewide collective that is the protocol or the decision tree about what happens, what do you do when somebody's symptomatic or they've been deemed positive, et cetera. So all of that is coming out hopefully by the end of the week. In terms of thermometers, we've purchased things out of CARES Act funding from the money we get to set aside to help offset those costs for districts. So we've purchased thermometers. In fact, back in the spring, that was one of the first things I did, was to ask our wonderful nurse liaison, Betty Sue Hinkson, to put out a survey and find out about thermometers in our schools. And I just have to share this because we came back and saw that one school had a mercury thermometer, and that was the only thermometer they had in the school. And we still had a lot of oral thermometers. And so that just shows you, going back to Heidi's comment about funding, that we don't have nurses in every school, and we certainly didn't have the right health equipment. So this is a way to take stock and see what you have in your health kit. So making sure we have PPE, including shills and gowns and thermometers. We bought, I think, 5 packs of hand wipes, the canisters of hand wipes for every teacher, so that they're not having to pull that out of their pocket, or the school's trying to fund that. But that still won't last. There will have to be other supplies. So really looking at what do you have in your school? What are your health kits look like? Are they up to date? So will there be a thermometer in every classroom? Unless there's funding that people have spent that in every classroom, we're relying on exactly what Dr. Memon said, and that is making sure that parents lean in, and they need to be responsible for symptom checking. And we know that some students will come to school sick. Maybe they haven't been checked on, or they haven't been honest with their family, or whatever the situation is. And if and when that happens, because we know it will, then there's a protocol to deal with the child. And that's something very different. We've let kids sit sick in our classrooms before. We just can't do that anymore. If a student comes sick to school, they'll be turned away, whether it's a cold or flu or heaven forbid COVID. Then that's something that we can't tolerate in this environment.
Both you, Sydney, and Heidi have talked about equity. This from Justin. Ethnic minorities, especially those who have or are learning English as a second language, are being affected by the COVID-19 virus in inordinate numbers. What is being done to better reach and educate our ESL student populations? Heidi, I'm guessing that the ESL teachers are already feeling overwhelmed. What is this additional layer of health and safety concerns doing to the preparation that they are going through right now.
Well, and I absolutely agree with the question, and I wish we had more answers, but I really do think that we need to start having a different conversation, not just about what do we need to do to open schools like right now, but how do we do it based on the science and based on addressing the needs of our most vulnerable and impacted right now. You know, we have our Black and brown communities and our kids in poverty are so much more affected by this virus on a number of levels, from the virus itself to access to healthcare, to access to childcare and working and healthcare. It's pretty stunning, and I think that our opening of schools should address that and say, you know, who are those students who are learning English, who you know, every conversation that they are missing out on in schools is an enormous amount of learning loss. Let's start to talk about how we can open schools safely for all, first and foremost, but do it in a way that gets those systems in place that are going to help our most vulnerable and our most impacted first, and then bring people who have more on.
Again, if you want to join us, send your questions to the hashtag Trib Talk. This is from Georgie on Facebook. The AAP, I'm not sure what that acronym stands for, recommends that schools should open based on science and medical experts' advice. Who is the medical expert advising Granite School District and their opening plans? Sydnee, you probably would have more insight on that. And then Dr. Memon, I'd just love to hear, you know, how if you've been invited to advise our school districts, and if so, like, what kind of advice are you giving?
Yeah, so like CDC is saying, there are 3 risk categories for kids going to school this fall. The lowest risk would be if we continue the distant learning that we did before the school session was closed. No, like face-to-face learning, not coming to school, all online distant learning. That's the lowest risk category. Then you have the highest risk category that, you know, we just do like nothing has happened, things as usual. No face masks, no these special measures like a hybrid model we're talking about. That's the highest risk, obviously. That's very dangerous. All these kids, clustered together in small classrooms, breaks, playground, all those things. That is a no-no. That will be a problem. So the moderate risk approach, I think that is probably what we should do, which is the hybrid model that's, you know, someone else has also mentioned, that, you know, maybe limiting the number of days a particular kid needs to come to school instead of all 5 days, staggering the entry and exit time for the school for various classes and kids, again, smaller class size, limiting playground, limiting, you know, going to the cafeteria for all the kids at the same time. And in China, I have seen they're using these pods for classrooms, like cardboard coverings 3-way with the screen in the front. So every kid has that in front of them. So, you know, the next kid is not affected and the transmission goes down on top of wearing a mask. So obviously all this is very cumbersome. It's going to be very costly, but I think the only way out, if we are going to open schools, it has to be the hybrid model.
Sydnee, do you want to tack on to that? Do you know who is advising the Granite School District?
I can't speak for Granite School District. I know, though, that they are leaning in with all of our local health directors. They have doctors advising them. So, you know, they're looking at the information, for example, that we've worked with the Levitt partners to learn about those 7 characteristics. We've conducted webinars to help our school leaders think through how they can open safely, think about what they need to mitigate. So we're putting out a lot of resources. And at the end of the day, districts are listening to a variety of parents, their educators, and at the end of the day, it's the board who votes and makes the decision. So I would just loop them back to Granite to ask those questions.
Sorry, Georgie, can't give you a great answer there.
Sorry, Georgie.
It looks like Lucy on Facebook. What is, wait, I'm not seeing it all the way. I need to scroll. What is this stress going to do to our teachers? How will it affect health and well-being? What is it going to do to our kids? What are the long-term effects of consistently being stressed out? This is incredibly stressful. And I think, you know, there's a lot of pressure. There's financial pressure for families. They, you know, they can't find health or childcare, or, you know, they were counting on school to sort of make up the gap. Are there going to be after school programs? I mean, all of these stresses really pile up. Laney, what are you hearing from parents out there?
We're hearing that. We're hearing that, you know, especially parents that are teachers, that is a stressful thing for them, not only to get their own kids involved in what the plan has to be for their own children's education, but also to be the teacher for other children. And that is a concern for them. The other thing is there has been also, we're seeing kind of the flip side of it, where parents have been concerned with their children by doing the online learning. Some of their children do not learn well with online learning, and they're like, get these kids to school. We need them to have some social. They're worried about their mental wellness at such a young age. There are some stress factors on that end. So we see it all. Like I said, it's the gamut of kind of the both sides, and it is a concern for everyone. The stress levels are going to be high all around.
Mm. Heidi, talk about the teacher part.
So I am hearing multiple times from all multiple times a day in all communications of everywhere from fear to anger from our teachers. And you know, we already had a shortage of people going into the classroom, and you know, about half of them leave after the first 5 years. And how we address things in this pandemic is either going to exacerbate that or help it. So it's really important moving forward. Long-term stress, I think, is something that's on all of our minds, from our adults to our kids, and it's something, you know, across the globe that we're dealing with. But we can control what we can control, and if we make sure that our schools are a safe place before we come back, that we don't rush it, that we don't put our children and our adults into a school situation before we can assure their safety, I think that we risk exacerbating that stress and make it worse. And we don't have to. We have to rely on the science. We have to rely on the data. We've got to get those numbers down. And then let's talk about getting back to school, because we all want it. And as Laney said, you know, we know that it's the face-to-face interaction that really makes for learning and makes our kids be able to thrive and see their potential. But our parents' level of stress in sending their kids back to school in a place that they don't know is safe is going to, I think, be pretty extreme. And we have that option. We can slow it down.
When we've talked about teacher stress, I'm not a teacher, but I assume that qualitatively it's very different to teach in front of a classroom than to teach online. And you've got to adjust your curricula and your approach and all of that. I mean, how can one teacher do that?
Exactly. And that's what I hear more than anything else. It's like, okay, we want to be safe. Absolutely. Number one, safe and healthy for all of our kids. But when the amount of work that it took to be able to, you know, turn on a dime and move from a real life classroom to doing school completely different was really enormous. And it was different for everyone. You know, we have some of our younger teachers who have the digital stuff down and not necessarily the content. And some of our more experienced teachers have a lot of the content and not necessarily the digital aspect of it. But we all know that if you are in school as an educator, as a teacher during the day, but you have some students who are doing school online. What does that mean for a workload? And those are questions that just haven't been answered, and that are a real concern about being able to have a work-life balance, and the level of expectations of managing both in-person, hybrid, and online students all at the same time.
That's a really heavy lift, Sydnee, for any individual. And then you add on the additional stress. How is that sort of factoring into the mix?
Yeah, I appreciate being able to talk about this because we've already seen some good plans and ideas where it's not about the teacher doing it all, but splitting those duties up. So for some of our teachers that perhaps might be immune compromised, or maybe they're just great at teaching online and wanting to do that and matching up with students who are going to be taking classes remotely, that's a good way to mitigate that. There are some systems where they're putting cameras in the classroom that are on the teacher. So if a student is home, they can watch the teacher online. There are a lot of the hybrid models where they're coming to school a few days a week and teaching remotely a couple of days a week. In one district, I know that they are releasing students early every day so that the teachers can work together and load all of their lesson plans on Canvas and continue to improve their skills while students are working on their assignments at home. So it's kind of homework and remote assignment time while teachers are practicing and learning and then teaching one day a week remotely. And that helps our system be nimble. We have this digital teaching and learning initiative that put our state ahead of other states. And by that, I mean that we had tools, we had devices that we could hand out, we had hotspots, we had all sorts of things, but we still had issues of broadband. We had free and reduced broadband in many places, but families would get on a list for 6 weeks. That's a month and a half of school before they could get that taken care of. We had families where the primary language is in English, especially families coming from refugee status, who had everything they needed, including broadband, and never logged on because somebody didn't come into their home and show them how to put it all together. So that's going back to that principle of equity, and the stress on our families has been tremendous. We know from surveys that our students have felt a lot of anxiety. It's very rare to find a student who hasn't experienced anxiety, either separation from their peers or from their teacher, or just the symbolism and being there in school. So all of that stress and anxiety, I've talked with a couple of district leaders who are wisely spending the first week just sort of debriefing and helping students with social and emotional well-being as they transition back into school, and helping prepare them to be resilient if something needs to happen and they're not in the building for a week or two, that they know how to step out of that. But really finding various roles for teachers so that they're not having to teach in 3 different ways on the same day, but sharing and having a hybrid model, as we've talked about, so that teachers are doing both. They're learning how to teach in a remote setting. That's the way forward in many cases, and teaching well, but not trying to work 10 and 12-hour days, which is what they were doing in the remote setting. So we've got to mitigate that stress for our teachers.
Yeah. Dr. Memon, you're an expert in infectious disease, so maybe stress is not your thing, but do you have any thoughts on the health effects that this prolonged quarantine and all the stresses and worries that come with it are having on people, just from your point of view?
First of all, AAP is the American Association of Pediatrics.
Okay, I was going to guess, but I wasn't sure.
And stress, I'm a big believer in the power of stress in terms of affecting our immune system. So the more sleep deprived, more stressful we are, the lower our immune system is, and it is counterproductive. So stress is huge. And stress goes both ways of not sending kids to school, kids being home for a long time now, their timetable, their sleeping, waking, cycle, everything is up and down, too much time on the internet, social media, video games, they're not getting enough physical activity. So all that is playing role. So, and then the psychology of just staying at home and not interacting with their colleagues, their friends, other students, I think that's taking a toll too. So stress is a big factor, and it's a problem. So, and also talking about teachers, I think we need to talk about our teachers as well. Teachers are adults who are more at risk for these infections and getting serious infections and having more morbidity and mortality. So I think we have to talk about them as well. It's not all about kids. And also I should comment here that the younger the kid is, the lower the risk in terms of getting severe infection. And the older the kid is, the more the risk, especially our high schoolers are the highest risk. Their immune system can be almost considered as an adult's immune system. So high schoolers are at the highest risk. The idea behind that is, the young kids, they don't have mature immune system. So in this infection with COVID, basically, majority of the cases, it's not the virus that actually is hurting us and killing us. It's our uncontrolled, unregulated hyperimmune system that's attacking the virus actually that kills us. So the older the child is, the more mature their immune system is, and higher they are at risk for this.
Very interesting. A few more questions. Keep them coming. Go to the hashtag Trib Talk. Let's see. This is, okay, Megan, she emailed us. She asks, what exactly are the strict social distancing guidelines that still allow for full classes? This seems to be a contradiction. So Laney, when you are hearing from parents, are they asking, so what does social distancing look like in a classroom?
There have been some concerns with that for sure, and wondering, the parents know the class sizes. They know how many kids are in those classrooms, right? And so they're doing the math, and they know that there's not enough space. 6 feet, you can maybe have 10 kids in the class. So where's the other 20 something going to be? So there is some concerns and definitely some chatter about how that is going to happen and be effective.
I'm sure this is a question that's sort of top of mind for you, Heidi.
Absolutely. When I first moved to Utah, I had 44 students at Copper Hills High School in my high school English class. I mean, our class sizes are large, and we must have some sort of backstop for what that physical distancing really means, and not just a comma when feasible. It has to be, how can we make sure that our kids are safe and that our educators are safe? Excuse me. We have teachers who are making the decision to retire.
I'll let you clear your throat. Sydnee Dickson, how are you thinking about social distancing? How does it even work when you have an overcrowded classroom already?
Yeah, we try to use the term physical distancing because I'm saying that for myself, Jennifer, because we've been so accustomed to the social distancing, and that creates anxiety for our students. Although I will say, based on some of the high school parking lots I see at nighttime, I wish there was more social distancing to keep students safe. But in terms of classrooms, this is where those models of splitting the class and having some students coming in the morning and some coming in the afternoon, people have been generous to say, we have after school clubs where kids can come during the day to cut down on class size. They can use churches. High school kids could work remotely, and we could spill into the high schools. But again, it gets back to Heidi's earlier point about we already have a teacher shortage. So it's also about spreading out teachers and, sending a paraeducator to teach physics. That's a very different scenario, or somebody to teach 6th grade over at a high school. So it goes back to all those challenges of equity that we talked about. We know that the highest group that disconnected during the spring were our students in middle school and middle school age, and then high school. In one large high school, there were almost 800 students who disconnected for almost a month. And teachers and counselors went door to door. They'd been calling and emailing and texting and getting no response until they physically tracked down the student to re-engage them. So that's the scenario in some of our secondary schools. So it's all those mitigating factors. I think the safest way to go about it, because we don't have teachers to cover, is to maybe split some of the classes. But I would be remiss if I didn't state what Dr. Memon stated earlier, and that is the economy goes hand in hand with education. And so that's also another factor that you have to think about. It's this trifecta of schools and families and the economy. And so there are just so many variables. People have answers that make it sound really easy to lower class sizes, but there's a domino effect. So the safest thing, keep numbers low in the class size by changing the schedule.
Kristen has emailed this. Will there be transparency at the school level as to when and how many are infected at any one time when outbreaks occur? I know that as a parent, I've gotten emails about, a fight on the school playground. I've gotten emails about, a teacher has been disciplined or whatever. Are we gonna, as parents, can they expect the same kind of transparency around infection rates at a school? Is it just going to be isolated to a classroom and then all of a sudden that class doesn't show up for a while? Like, are there specific guidelines you're looking for in the district plans, Sydnee, when it comes to transparency?
That's where the health departments, again, are working with our schools. So first of all, in the spring, when we didn't really know a lot about the virus, we had a case in one particular elementary school, a charter school, who had a sibling in a high school. And both of those schools were emptied out. We shut down the schools by order of the health department. And it was probably the right thing to do at the time. Now we know that we can contain some of it based on contact tracing. So there will be, if you were a parent and there was a student in your child's classroom who tested positive, you would get a letter indicating that a child in your child's classroom tested positive and you need to watch for the following symptoms and do the following things. So contact tracing is going to help a lot with that rather than emptying out the whole school. Now, if you start to see a spread of infection, then that's a whole different scenario. But there are protocols that will be, our schools will be guided on, so they're not having to make those decisions. It wouldn't be appropriate. We have HIPAA laws and FERPA that really protect the privacy of a student. It wouldn't be appropriate to name who that student or that employee is, but certainly letting parents know and letting employees know that somebody has tested positive in a classroom or on the faculty, et cetera.
Our time is just about up. This from Anna on Facebook. Dr. Memon, what letter grade would you give Utah school districts on their reopening plans? It's not very fair to ask you because the plans have not been submitted. They're not due until August 1st. But I guess just generally, how are you feeling about the preparations as a healthcare provider, as an infectious disease expert?
Well, I think the preparations are underway. I'm hearing a lot of things. I'm reading a lot of things. So I think we're taking notice and I think we're trying to be prepared. So I like the efforts so far that are going on. But I just would like to comment that I think masks do prevent infection. And I think if we're not talking about with this second rise in Utah, we're seeing our highest numbers ever. We're not asking as a healthcare community for a second lockdown. All we are saying, this is a bargain. This is a trade-off. If everybody wears masks outside, I mean, right now you go to a gym, nobody is wearing a mask. All these young people working out, huffing and puffing next to each other. Masks were only required at the entry of the gym, and inside nobody has a mask on, maybe 2 to 5%. So, I mean, this is like a wildfire right now going on. So if everybody has a mask on, we can keep businesses and different places open. Our life can go on. It's a simple trade-off. It's not politics. I think it's just it's our duty as a community to do that for our family, our friends, our relatives, everyone. And I think that's what needs to happen, to be honest with you. And we've been requesting that this happens. And our numbers can significantly go down. One should ask, people are asking outside the US, what is happening in the US? You are the most powerful, rich, advanced country in the world. What is happening here? I think what's happening is that the whole thing is politicized and we didn't use masks. Countries like Denmark use masks and their numbers are very low. So if we had done that from the beginning, I think we would not be in this mess that we are in right now.
Yesterday, we launched a Twitter poll asking followers if they felt comfortable with the state and district plans to go back to school. Again, it's a little premature because we don't have all the details, but about 4,800 people voted. Overwhelmingly, 82.2% said they were not comfortable going back to school. So I guess my final question for all of you is, what is one thing that you hope would happen between now and the start of school that would boost people's confidence in this plan? I mean, is it going all online like Salt Lake City, as long as they are staying in the orange? Like, what is it about, what one thing would help calm the fears that are out there? Laney, I haven't heard from you for a bit. What do you think?
You know, I would encourage people to do some of their own research. I think getting information just from social media and not going to, you know, maybe the CDC or some of the things that our state health department has put out, it creates this fear, and people don't function in fear. You add stress, you add, you know, anxiety, you add depression. So I think it's good for us to kind of take a step back and really do some of our own research and not just speculate on everything. Like it's good to figure out for yourself what is happening and what's going on. And obviously the parents are going to make the best decision for their own families, as it should be. But I would hope that as a society that we really try to investigate more just for our own peace of mind and know, I love to learn new things all the time. And I love to go on some of the CDC things and learn. I learn something new all the time. And so I would encourage people to do that before they jump on the bandwagon that they don't know things. And it goes to both sides, whether you want to go to school or you don't want to go to school. I think you have to look at the risk of staying home with the children versus the risk of going to school. So that's what I would encourage people is do your homework, do your research, and make the best decision possible for your family.
Dr. Memon?
I think I conveyed my message. You know, I think schools probably can open if we do all the due diligence and take all the precautions with the hybrid model that I suggested, or in the talks and recommended by CDC. And I think we just have to also watch for the next 2 to 3 weeks, which way the numbers are going in our state. And I think if the numbers keep rising and going up and our hospitals are full, you know, we might have to reconsider the whole idea. So I think this is a fluid, ongoing, dynamic process, and we just have to see how this goes. But I think the hybrid model would work if our numbers keep dropping over the next 2 to 3 weeks. And again, the message is please wear a mask when you're outside.
What's your one thing, Heidi?
I think we all agree that we want our kids back in school. I know teachers, we want that more than anything, to be back with our kids. But we need to do it safely, and we can do that creatively. We can do this. We can get this as a community, as a state, but it is going to take that creativity, and it's going to take the resources. And the resources have to be there, and they have to be a requirement, and not just if we can swing it.
Sydnee, we've heard if feasible. Maybe, you know, what is the one thing that you're hoping will happen between now and the start of school to make things feasible?
I concur with everything that's been said, but I echo what Dr. Memon said, and that is, you know, we are a state that has the highest percentage of volunteerism. It shows we care about each other and about people. Why doesn't that translate to masks? And doing what we know will make a difference, and that's wearing masks, distancing, and hygiene. And if we continue to do those three things with vigilance all together and take the politics out of it, then we can be better prepared to be safe as we start school. And I really trust our educators. They show up with creativity and problem solving skills every single day. And we need to give them resources and tools and more information to families so that they feel safe. And a lot of information I think will come out in the next couple of weeks. But let's stop the spread by doing what we know.
Sydnee Dickson, Heidi Matthews, Laney Benedict, and Dr. Memon, thank you all very much for sharing your expertise with us tonight.
Thanks for having us.
Thank you, Jennifer.
Thank you so much.
That's it for our Trib Talk Town Hall. You can find and watch previous town halls on the Tribune's Facebook page. Thanks to our producers, Sara Weber and Jeni Fitzgibbon. And thanks to all of you for watching and your great questions. Stay well.